I wrote a book about 4 years ago, and I gave it the title, The Handbook, Surviving in a Germ Filled World. But first, I want to say that I am honored to be here with this group of very accomplished professionals, and I am really pleased to meet some individuals who have really contributed to the field, a field that I've been thinking about for years now. When I wrote this book, and I gave it the title, The Handbook Surviving in a Germ-Filled World, I had a hypothetical vision and thought that this was going to happen perhaps in my lifetime, and then here we are. And the interesting thing about this experience is that 4 years ago, the people who were interested in it were already people practicing in the field and were convinced that this is a thing, that hand hygiene really is important. However, the vast majority of the public was kind of neutral or disinterested, and all of a sudden, everybody is on board with hand washing. So that's something that I find to be really a revelation with regard to what's going on today. So thank you, Maryann, for putting together this wonderful session, because it is a compelling issue, and the issue of hand hygiene will stay important, in fact, critical, even when we are beyond the current crisis worldwide. So the message is very, very important, and the message is so important about hand washing that there are 2 dedicated days every year for the cause of hand hygiene, and one is coming up next week. It's the World Health Organization's World Hand Hygiene Day on May 5th of every year, and the other one in October is the Global Hand Washing Day, sponsored by the Global Public-Private Partnership for Hand Washing. So that shows you how important it is in the minds and hearts of anyone who cares about public health. Now, of course, I want to greet the audience from around the globe, all of whom appreciate these issues, but I'll just mention that we are concerned now in particular, but always, about germ-laden surfaces in public places. And this is just a list of some of the things that we touch all the time and don't give much thought to. However, when we're in the midst of a corona pandemic, it all of a sudden becomes so important that you went outside and you touched something, and now you'd better sanitize your hands. And in healthcare settings, it becomes even more important because, you know, we're talking about life and death in an immediate way. And these are just some of the numbers associated with the tragedies that can occur if hand hygiene is ignored or if it is marginalized. So, for instance, we have the figure of 5 to 10% of hospitalized patients who contract hospital-acquired infections. And that includes, very sadly, my mother, who passed away 20 years ago in a hospital, very fine New York hospital, but she passed away from a hospital-acquired infection, even though she went in for cardiovascular disease. So this is a very personal issue for me, in addition to the professional importance of it. And it highlighted the fact that some healthcare workers did not wash their hands properly, and some are still learning. And now, of course, we see our healthcare workers and public health professionals on the front lines are doing everything they can to do everything right to reduce the risk. And that is something that is gratifying, and that message is registering. Let's go back in history, because the idea of hand hygiene, although it seems like the science and the scientific approach has been very recent, the science goes back a couple of hundred years, but the idea of hands being impure or soiled, that goes back thousands of years. And so we can look at religious hand washing rituals that have been discussed and written about for thousands of years in Islamic and Jewish and Christian and Hindu sources. And those individuals from those groups and for people of other faiths have used hand washing as part of religious rituals. So, for instance, 3,400 years ago in the Hebrew Bible, the Old Testament, the Israelites made a basin for washing, and the citation in the book of Exodus says, "They shall wash with water that they die not." Okay, now that's a statement about hand washing that goes back thousands of years. Now, of course, we're talking about ritual washing, using a cup to pour water over one hand on the other hand. Turns out that recent studies show that ritual hand washing, just rinsing with clean water, does significantly reduce the risk of germs. So there was something already there back then, thousands of years ago. Let's fast forward to ancient Greece and Rome, and then to the Middle Ages. The word hygiene is Greek. It was the goddess of health and cleanliness, and in the Greek culture, hygiene was very important. They established public water supplies, and fountains and bathhouses were important within that culture. Even though they did emphasize cleanliness, there were plagues, and the plague of Athens decimated the population in the year 430, 430 BCE, before the Common Era. Following the Greeks, the Romans also emphasized health and hygiene, and yet they were decimated by a plague that killed a third to half of the population, the Antonine Plague. And then we have hundreds of years, centuries of time when people more or less ignored hygiene and hand washing. And this culminated in the Black Death in the 14th century that killed almost half the population. And included much of Europe and Asia and North Africa. So these were, of course, terrible tragedies, part of our history and the history of public health, from which we can learn some lessons. Then we turn to just several hundred years ago, the era of what people have called microbe hunters. One of the very first, Anton von Leeuwenhoek, developed a microscope that was able to reveal the microscopic world of microbes, including pathogens, which are the disease-causing agents. He's quoted as saying, upon observing the microscopic world, "Come here, hurry, there are little animals in this rainwater. They swim, they play around," and so on. So this is, of course, a great advance in science to be able to discover the microscopic world. Continuing with the microbe hunters, we have the person who I have called the father of hand washing, Ignaz Semmelweis, who lived in the 19th century. And he did indeed discover and document for the very first time the relationship between hand washing and the reduction in infectious disease in a hospital setting. He worked in the Vienna General Hospital, and he observed that doctors who staffed the maternity ward had maternal deaths from childbed fever, puerperal fever, that were significantly higher than the clinic where midwives were delivering babies. That he discovered that the doctors would work in the morgue dissecting corpses and then run to the maternity ward to deliver a baby without washing hands in between. At one point, one of his friends, a doctor in the clinic, accidentally cut his hand with a scalpel. He contracted that disease and he died. And this certainly was a wake-up call. And Semmelweis hypothesized that cadaverous particles, because they weren't known yet as specific microbes, from the morgue were killing the mothers. So he was able to arrange the hand washing for doctors between the morgue and going to the women to deliver babies. He tested his theory. They required doctors and medical students to wash their hands and the instruments in a solution of chlorinated lime. The mortality rate for the new mothers dropped from about 18% to about 1%, which is a tremendous success and saved a lot of lives. despite his success, it's very hard to change prevailing views, and his idea was met with great resistance. They actually terminated his contract. He returned to his roots in Hungary, to a small hospital, where he implemented the same changes and saved lots of mothers' lives. But he had, it is said that he had a breakdown, a nervous breakdown, and he died in a psychiatric institution, a broken man at a very young age of about 47. So that was a tragic story of really a healthcare hero, and that's something that we can learn from. Here are some other microbe hunters that I will mention because of their tremendous contributions to the field of public health. Florence Nightingale, probably the mother of all of nursing, improved hygiene in military hospitals during the Crimean War in the mid-19th century. And her ideas about hygiene helped not only in healthcare settings, but also in terms of household cleanliness. And she influenced many people to implement better hygiene practices. We go to Louis Pasteur, who is probably one of the most important scientists contributing to healthcare. In the mid-19th century, not only did he raise awareness of germs and pathogens, but he also devised various types of protocols to reduce the risk of pathogenic microbes. For instance, heating up milk to decrease the amount of microbes in milk. Now we call that pasteurization. So every carton and bottle of milk that we have has his name on it because it says pasteurized. And he changed our understanding of many areas of biology and medicine, infectious disease, and health and hygiene and immunology. And his work helped us to address diseases such as rabies and other infectious diseases. But he also worked in the alcoholic fermentation industry, the silk industry, and developed ways for us to deliver our products aseptically, aseptic packaging. So, of course, he made tremendous contributions. And following his lead, Robert Koch was the scientist who discovered the anthrax bacillus and launched a research field where we could link a particular pathogen to a particular disease. And so once you establish cause and effect, then, of course, you need to devise ways to eradicate the disease, to target those pathogens. And he worked on cholera, tuberculosis, diphtheria, typhoid. Those were areas where scientists used his methodologies of linking the pathogen to the disease, a tremendous breakthrough. One other scientist I'll mention is Joseph Lister, who pioneered antiseptic surgery. And just a couple of decades after his work was published, there was a company that produced an antimicrobial product and named it after him. That's Listerine. But of course, his work influenced the way all surgery is done, and as did the other scientists. And hand washing became a routine and required part of surgery. And now, of course, it's a routine and required part of all lives and everything that we do. You are all familiar with the different types of microbes, all of which have examples that can cause disease. And nowadays we're thinking mostly about the viruses, but of course, bacteria and fungi and protists are able to serve as scourges to populations in different parts of the world and in different populations. Now let's turn to the hands a little bit more, because hand microbiomes, that is how we describe all of the microorganisms on our hands. And the term microbiome has become very important in the past decade or so, because microbiologists are interested in cataloging all of the pathogens. And if we can learn about all the different species that live in a particular area, then we can target those that are making us sick. We can target the pathogens and try to preserve the ones that are not dangerous to us. So the human skin microbiome harbors more than 1,000 species, and some of them are benign, like staph epidermidis, but some of them cause very severe diseases and deadly diseases, like Staphylococcus aureus and Streptococcus pyogenes, as you can see from this slide. If you send your child out to play in the backyard, bring them in and have them put their hand on a petri dish, this is the picture that you get on the left. And it shows you that our hands are just filled with microbes, many of which are harmless, but some of which can make us sick. And hence, we're here talking about hand hygiene. And this little fella is one of my wonderful grandchildren's newborn hands. It was just irresistible to me because I was writing a book about hand hygiene. So who is washing hands? So what is this about hand hygiene that makes it so compelling? And the answer to that is that we can be empowered to do something to keep ourselves healthy, and that's, of course, hand washing. There are many studies that I cite. I really reviewed much of the literature when I wrote my book, The Handbook, Surviving in a Germ Filled World. So I read an awful lot of works from hundreds of years ago up until, present times. This study showed that if you ask people, do they wash their hands after using public bathrooms, 96% of them say, yes, of course I wash my hands. But if you observe them, you'll find out that there are many populations that don't really wash their hands. So for instance, when people were observed in the public washrooms in various airports, in the Toronto airport, 95% actually do wash their hands, so that's a good score. In the Miami airport in Florida, in the US, 81%. In Chicago's O'Hare airport, it was 73%. And New York, my hometown, the JFK airport, only 70% actually did what they said they're doing. So at that point in time, people were not aware or were in denial about the importance about hand washing. And a lot of people simply didn't wash their hands after using public restrooms. That sounds kind of appalling, and yes, it is. If you they did a study of college students who you think, well, they're intelligent, right? They're educated. After defecation, 84% of females wash their hands and 78% of males, which means that about 1 in 5 come out of the bathroom without having washed their hands. And after urination, it's 69% and 43%. I would imagine that after this experience of the COVID virus, people are much more hand aware and much more germ aware. So I believe that these numbers will be higher and better, and perhaps this effect, the corona effect, I would call it, may last. And as a lasting effect, it will help our public health in many, many ways for years to come. That's the hopeful part, the silver lining in the cloud. In our laboratory, we have been studying bacteria and the transfer of bacteria from one surface to another. We are so aware of this now as we go out into the germ-filled world, and we don our masks and gloves to try to avoid catching the coronavirus. Because it's not just hands that transfer germs, the other surfaces, the fomites, carry and transfer germs as well. So my lab has been involved with looking at different types of surfaces. We focus on fabrics, on different clothing and so on, to see what types of fabrics carry and transmit germs. We've studied polyester and silk, cotton, wool, microfiber, and scrubs. And one particular material stood out as being something very interesting. It's a kind of microfiber that seems to repel bacteria. So in our experiment, the different fabrics transfer E. coli and other bacteria from one to the next, but the microfiber doesn't appear to transfer E. coli to another swatch of microfiber. And there's something special about this. It happens to be hydrophobic, but it also repels germs. And this is one experiment that I'll show you quickly, where we did from one swatch to another different kinds of materials. And in one case, we had no transfer of bacteria. The cloudy white material is E. coli colonies, and it does not transfer to another swatch. On the bottom, on the left, the white material did not transfer from one swatch to another. That's the microfiber. So those are important types of observations because we want to reduce the transfer of all types of germs, bacteria, and of course viruses. And this is one example of a research study that we did that should be helpful, hopefully, to reduce the transmission of germs. Microscopically, we looked at these fibers, and you can see clouds of bacteria surrounding silk and wool and polyester and scrubs, but microfiber on the bottom right appears very clear and actually repels the cells, the bacterial cells. So we were very excited about this. When looking at differential adherence of bacteria to microfiber and scrubs is the the garment that the surgeons and healthcare workers are wearing. We find that microfiber has a much lower amount of bacteria compared with scrubs, and across the board, this was all statistically significant, except for one instance where it showed a trend but not statistical significance. So under various conditions, microfiber appears to repel the germs. And that's something that we are pursuing in greater detail. This shows you what it looks like in the electron microscope. So conclusions regarding this particular research study is that the different kinds of bacteria adhere to many fabrics. That's something of concern if you're in a hospital setting, and nowadays, wherever you go, you're concerned about this. Microfiber stands out as having the lowest level of association with bacteria, and natural fibers appear to have the greatest affinity. So this is the kind of thing we're looking at in order to advise and make recommendations with regard to healthcare settings. And microfiber is less likely to transfer bacteria to other fabrics. We also studied various ways to decontaminate, like hydrogen peroxide, and those are some of the things that we are concerned with in our research lab. Another study that we conducted that I'll go through very quickly has to do with food handlers. And this publication in the Journal of Community Health discusses how various food handlers in food carts in New York City are not doing the things they're supposed to be doing with regard to hand hygiene. Now, it probably changed or will change in light of what we're going through now. However, these observations, which were just made a year or two ago, showed that the number of times that food vendors changed their gloves out of almost 500 exchanges, only 7 times. So our food handlers were not doing what they were supposed to be doing. I think that this very tragic pandemic is going to change some behavior. We shall see. But certainly it's something of concern. We did transactions with food vendors and collected change, right? Money, these are dollar bills that we collected, and then we cultured these dollar bills to see what grows on the money that's being touched by the food vendors who are touching our food. Okay, so there's a chain of transmission, touching money and then touching food and then giving you the food to eat. So what's doing with these dollar bills? And sure enough, most of the dollar bills are contaminated with a variety of different kinds of bacteria, which is what we were studying. And a good portion of them were coliform bacteria, which can be disease causing. So this slide doesn't look as good as it did when I uploaded it, but these are the top 10 simple, empowering solutions for everyone. And we know a lot of this now that we are in the midst of this pandemic. Number one, don't shake hands. But what I would like to say is that when all of this is behind us, which one of these types of behaviors will stay with us and will help to keep us healthy and empower us to continue to do the right thing? Will we go back to shaking hands? And will we do the fist bump? If you do shake hands, my approach, my philosophy is to be germ aware. I go out in public and I do touch things, and I always have, even though I wrote the book on hand hygiene. But if you do go out and touch things, just be germ aware and make sure that you sanitize your hands either by good hand washing with soap and water or with a alcohol-based hand rub. So keep your wash areas stocked with soap and clean cloth towels or paper towels, and keep your alcohol-based hand rub handy. And especially for caregivers, for children, or for adults who need their care, it's important to keep your charge's hands clean. And teaching your children about hand hygiene, we can't emphasize that enough. And if you are a supervisor at work, make sure you have facilities for your workers to cleanse their hands. Healthcare workers, it goes without saying, but I'm going to keep on saying it forever, that healthcare workers have to be vigilant about hand hygiene. Every patient should ask their healthcare worker, if they're stuck in bed, to have somebody help them wash their hands before they touch their face. Even if you're in bed and you're a patient, you should still be washing and cleansing your hands. If you're buying food in a food preparation facility, restaurant, or street vendor, be aware of who's touching your food and how they're touching it and whether they are washing hands. And let's keep track and learn about our local health codes and advocate for them so that we have strong legislation to protect us. Just these are some practical things that should remain with us after this crisis, after we pass this crisis, because there will be other times in the future where we'll be grappling again with challenges, hopefully not as widespread. The book that I wrote, the handbook, Surviving in a Germ Filled World, talks about the science, the medicine, the history, and the culture, solutions to these issues, and even handy lists of ways to lower your risk. And I do think that we can learn a lot about this. By the way, this is a portrayal of a subway or underground. This one is in Japan. And we hope that one day we can get back to public transportation with confidence that we can stay safe even in that type environment. I just appreciate the opportunity to speak within this group of experts who have been working on so many different areas of this. I'm very honored to be part of this group, and I look forward now to hearing from my esteemed colleagues who are going to continue and tell us some of the other aspects of hand hygiene that are absolutely critical in this time. And I will just to end by saying, please everyone, stay safe and stay well, and continue to transmit this message that we can be empowered. There are things, simple things we can do to keep us safer and healthier and reduce our risk. And again, thank you for inviting me. It's been a pleasure. These are some of my colleagues, my acknowledgments.